And on Glioblastoma Awareness Day, my understanding is the purpose of this day is to do two things. One is to honour the lives of people who we've lost because of glioblastoma, and the other is to raise awareness of the kind of actions that we need to take to save more lives. Bit unfair to spring this on you, so I'm going to do it for myself too. But is there anybody in particular or anything in particular that you would like to honour on that day? And is there any kind of action that you think might really help us make progress in glioblastoma on that day?
Sure. Yeah, I mean, I think we really need to honor all the patients who, they, and every day, are dealing with this terrible, terrible tumor. And patients who are involved in, clinical trials or not-for-profit groups to increase our awareness. This day is for them. And I think the only way is really research. And we need more federal funding. We need more clinical trials, more interest from pharmaceutical companies to invest in this disease so we can make progress.
I also, on Glioblastoma Awareness Day, I have met so many new people since I was diagnosed, particularly on social media, where we have patients and caregivers who are incredibly active from all over the world. And I've forged brilliant relationships with people. And I want to honour the lives of some of those who I've met and have now since died. But I want to honour the community. And I also, in terms of calling for action, of course we need more money, but I also want, I think an action that we can all take is to look at each other as collaborators in this movement. And I'm so happy to hear your answer. The days of the medical deity and the passive patient are over. And active patients, the more that we can channel our fears and our frustrations, which we share with you, into securing desperately needed research funding, one that gives greater respect for patients as active players in that research, those research avenues. I think that would be a wonderful way to mark that, although it's a deadly disease, I, for one, am very lucky to be very alive now, and I want to show that with great neuro-oncologists like yourself, we are going to get there one day. It's just a question of when, not if, isn't it?
I completely agree. Progress is happening. Will continue to hopefully exponentially happen. That a cure will be possible.
Cheers on that.